Hey all, Adam Fox here for another installment of What Does the Fox Say? I want to talk about the weedy, wonky Notice of Benefit and Payment Parameters rule that recently came out. This is a rule that comes out every year and is usually used to make very minor tweaks and adjustments to ACA plans and ACA marketplaces. What we're seeing in this year's proposed rule under this regime goes well beyond that and is fundamentally an attack on the Affordable Care Act and affordability for Americans who enroll in ACA plans. What the proposed rule would do is significantly increase the out-of-pocket costs that consumers would face really across all of the ACA plans, but it proposes to allow much broader access to what are called catastrophic plans that really provide no coverage up front until somebody meets their maximum out-of-pocket, which are set shockingly high. For an individual, we're talking over $15,000. For a family of four, we're talking over $30,000. We know that those out-of-pocket costs are not affordable for the vast majority of folks. But they are also proposing to allow these plans to essentially vary the cost sharing based on medical condition. That is something that really should not be allowed under the ACA because it will lead to discriminatory benefit design and really leave people with serious medical conditions at risk. The rule also proposes to allow insurers to essentially offer plans that don't guarantee any form of a provider network. And there are huge questions about how this would even work, but fundamentally, we don't see a way that these types of plans would be able to maintain the protections that are fundamental for patients and consumers under the Affordable Care Act. And it would leave consumers in the middle of a whole lot of billing scenarios that would make life that much harder for folks. One of the most alarming changes that is hidden in this rule is to essential health benefits. That's the core set of services that all ACA plans have to provide. What the rule proposes is to really severely limit states' ability to modify and update our essential health benefits to meet the needs of our population. And it would essentially penalize states who create laws or requirements for particular benefits beyond the current essential health benefits package. That's not going to help our healthcare system meet the needs of our population. It doesn't make our healthcare system healthier. It doesn't make people healthier or provide access to the services that people need. I think this rule is fundamentally another attack, sort of death by 1,000 cuts to the Affordable Care Act, and you need to put this in the context of things like the termination of enhanced premium tax credits at the beginning of the year, and other things that are simply making coverage less affordable, less accessible, and less meaningful for people. And that seems to be the goal of this rule. So we are trying to raise awareness about what is happening. This is yet another attack on the ACA. So please help us share this video, share your healthcare stories, and please speak up against these kinds of attacks. Thank you.